My name is Cassandra Snyder Wyatt. Today is September the 23rd, 2019. I am a 7th semester nursing student here at Lincoln University, and today I will be performing tracheostomy care and suctioning on my patient, Ms. Opal here. So I've already come in and I've identified my patient by 2 patient identifiers, her name and date of birth. I've positioned her into high Fowler's position, and I've raised my bed up to a working height. Miss Opal, I've already assessed her, and her lungs are very crackly and wheezy. She's having kind of a hard time breathing. She has lots of nasty secretions. You can kind of see some here on her gown. They're very green. Her rhythm of breathing is uneven, so she's just kind of having a hard time. So we're going to go ahead and suction her out. Her pulse rate and respiration rate are also kind of high, so we're going to see if suctioning will fix that. So at this point, I'm going to go ahead and hyperoxygenate my patient. I'm going to turn my suction on between 80 and 120. Ms. Opal's secretions are a little thinner than some, so I've got her suction closer to 80. If they were thick or hard to get out of the inner cannula, I would go ahead and turn it up a little bit higher, towards 120. I'm going to provide her with some privacy by closing the curtain here. For the video stick, go ahead and push it back because all my suction and oxygen is back here behind me. So at this point, we're pretty well ready to go. I go ahead and put a towel over her chest. That way, if there's any kind of secretions that come out while I'm suctioning her, it doesn't get on her gown. I'm going to perform hand hygiene. I'm going to set up my field here. I'm going to go ahead and open up my suction catheter tray. And then I'm going to open my sterile gloves. And I would make sure, I've already kind of pre-discussed how Miss Opal can help me do this procedure. We've discussed that she will raise her left hand if she's in any kind of distress, or if I need to give her a break. She's having a hard time breathing while I'm suctioning her, or if she's in any pain, or she just plain old needs a break. So I went ahead and donned my non-dominant hand with my sterile gloves first. I'm going to don my dominant hand. Okay, so I'm sterile. I'm going to put that away. Okay. I'm going to take my little box here, and I'm going to put my sterile saline in it. Throw that away. I'm going to grab my suction catheter here. I'm going to wrap it around my hand. Okay. Now, I'm going to contaminate my non-dominant hand to grab my suction catheter, which I have already placed on the bed. I'm making sure not to contaminate my dominant hand. I'm going to test my suction. It works. I'm also lubricating the tip of this. And then at this point, I'm going to go ahead and take off Miss Opal's oxygen and remind her how she can help me. Okay, Miss Opal, remember, if you need a break, or if you're having any pain, or if you're having a hard time breathing, just let me know, raise your left hand, and I'll stop. So I'm going to make sure I'm not suctioning on the way into the cannula, and I'm going to go in until I meet resistance, and intermittently suck on the way out. Making sure to twist on the way out, that way I can get all the secretions around the cannula. I'm going to clear my tubing. If my patient was in obvious distress, or if they needed a break, I could hyperoxygenate them again, making sure not to contaminate my dominant hand or my more sterile hand. At this point, Ms. Opal's okay. So we're going to go ahead and suction one more time. Going down until I meet resistance here. And then on the way out, intermittently suctioning. Great job. So I can tell that she is breathing a lot better here. So I'm going to go ahead and grab my V-sponge out from underneath the tracheostomy here, carefully. Going to put it and the inner cannula inside one glove. I'm going to reoxygenate my patient as needed and turn off my suction. And then I'm going to go ahead and take off my sterile gloves. I'm going to clean up my area here. I would also want to make sure that I reassess my patient. Her lungs are more clear now. She's having a lot easier time breathing. So I know that I am ready to go ahead and perform her trach care and clean the inner cannula. I'm going to go ahead. Her oxygen saturations are okay, and she's feeling okay. So I'm going to take her oxygen mask off here. Then if any time during this my patient desats or decides that like they're having a difficult time breathing, I can reoxygenate them and then redon new sterile gloves as needed. I'm going to go ahead and open up my trach care kit here. And then I'm going to don some new sterile gloves. Open up my sterile gloves. I can throw that out. And then if I need to perform hand hygiene once more. Then now I'm ready to open up my sterile gloves. On my non-dominant hand first. On my dominant hand second. I'm going to get this out of my way, being very careful not to contaminate my sterile hand. And then now I'm ready and I can set up my sterile field. When I set this sterile field up, I do want to keep in mind that I do have a 2-inch border around the sterile field that is considered non-sterile. And now I'm just kind of setting up this sterile field. Okay, at this point I have 2 containers that I will separate sterile saline between. I have hydrogen peroxide here. I'm going to go ahead and dump it in one of the containers. I'm going to grab my sterile saline. I'm going to put half in with the hydrogen peroxide and then the other half in the other container of just sterile saline. Okay. At this point, I'm going to take my non-dominant hand and grab my inner cannula and take it out. And I put this in my hydrogen peroxide mix. I'm going to let it soak for a second. With my dominant hand, I'm going to grab my brush out of my sterile saline. Non-dominant hand, I'm grabbing my inner cannula out of my hydrogen peroxide mixture. And now I'm going to clean my inner cannula. I'm going to put my inner cannula in my sterile saline. And I kind of let it wash off some of that hydrogen peroxide mixture here. I'm going to grab it with my dominant hand. I'm going to tap it on the middle of this container. I'm tapping it to make sure that all the water gets out of this cannula because you don't want to introduce a whole lot of water into your patient's respiratory system. I'm going to go ahead and put this back in, staying as sterile as possible. And at this point, I'm going to go ahead and clean around my patient's tracheostomy, around the incision sites. So I'm going to grab a sponge here. I'm going to kind of soak it in sterile saline, and I'm going to wash around the flanges. I'll clean off the flanges if the patient needs them cleaned. And you want to make sure, like I said, that you stay as sterile as possible doing this. You can do this with these 4x4s. You can do them with Q-tips, which I'm going to grab a Q-tip as well. And I'm just making sure that we get this nice and clean for my patient here. Okay, and then I'm going to take a dry sponge here, and I'm going to dry my patient. Because you don't want to leave around this tracheostomy wet. It can introduce bacteria. It can cause skin breakdown. Okay, and at this time, I'm going to go ahead and replace my my ties around my patient's tracheostomy. If I had an assistant, I would have them hold the flanges and help me with the other side of the ties, but I don't. So Miss Opal is alert and conscientious enough that she can help me. So she's going to sit up whenever I ask her to. Okay, Miss Opal, go ahead and lean forward. Which she is. I'm going to make sure that I put my new trach ties on while the old trach ties are on. That way my cannula doesn't come out or anything crazy happens. Sorry, I'm reaching over you here, Miss Opal. I'm careful not to turn my back to my sterile field here. These ties really do go in this flange here. There it goes. Okay, I'm going to connect that. I'm going to check between the new trach tie and make sure that I can fit 2 fingers between it, which I can. I'm going to take the old trach ties off. There we go. Okay. And I would throw those away and undone my gloves. For the video's sake, I'm not going to don a new pair of sterile gloves. However, at this point, I would don a new pair of sterile gloves to replace the V-sponge, which is the next step. So at this step, I'm now sterile. I'm going to replace the V-sponge on my patient underneath her cannula here. I'm going to grab my V-sponge. I like to use Q-tips to help me place this under her trach ties and under the flanges because at this point you need to stay as sterile as you can. Place it. Okay. At this point, I'm going to go ahead and contaminate my non-dominant hand. That way I can kind of move these trach ties out of the way. Okay, I'll throw that Q-tip away. I grab these and kind of make sure that the sponge is around my patient's tracheostomy appropriately. And now I'm done. I'm going to re-oxygenate my patient. Here you go, Ms. Opal. Here's some oxygen. I'm going to turn my oxygen back down to what it was before. I'm going to lower my patient back down here. I'm going to take the towel. My bed's going back up. Okay. Normally the bed stays down. I'm going to throw my towel in the dirty linens, and I'm going to undone my gloves. I'll clean up my area here, and after I know that my patient is stable and my area is cleaned up, I would then go document how my patient tolerated the procedure, the characteristics of all of her secretions, what color they are, if they were super thick, that she's breathing okay, and that I changed her dressing.